Hi guys, my name is Salima Abrams, and today I am going to talk to you guys about substance use and the issues that we are dealing with as a community. So imagine waking up every day with the fear that someone you love might not make it through the night because of substance abuse. This is not just a fear, it's reality for many families in our community. Substance use and drug overdose are tearing apart the fabric of our society, and we need to take immediate action to address this crisis. The problem of substance abuse is devastating. Overdose deaths have skyrocketed, and every day more and more lives are lost. Families are being destroyed, and communities are suffering. Substance use leads to health issues, economic burdens, and increases in crime rates. It's not just an individual problem, it is a community problem. It's a community crisis and it affects us all. The stigma of the stigma and lack of resources for treatment only exacerbate the issue, making it harder for those in need to seek help. To address this crisis, we really need to have a comprehensive approach. First, we must increase funding for rehabilitation and treatment centers to ensure that everyone has access to the help they need. Education and prevention programs in schools can help deter young people from starting to use substances in the first place, and it's important for us to be able to have conversations with our youth. Um, the community support groups and hotlines can provide ongoing support for those in recovery. And lastly, we need to advocate for policies to prioritize mental health and substance use treatment over punitive measures. Um, Imagine a community transformed, families are reunited, and individuals who once struggled with substance use now lead healthy, productive lives. Picture community centers full with support groups and educational workshops that prevent substance use among the youth. Our streets are safer with lower crime rates and stronger community trust. The positive ripple effect is felt throughout the community, creating a more vibrant and prosperous environment for everyone. However, on the other hand, if we fail to act, the consequences are dire. Rising overdose deaths will lead to more funerals and more grieving families. Relationships will be strained, and the economic burden will increase as healthcare costs skyrocket. Our streets will become less safe with higher crime rates and corroded community trust. The sense of hopelessness and despair will take over, preventing people from seeking help and perpetuating the cycle of substance abuse. One thing that I believe is at this point in the society that we're living in the crisis that we are living in, um, I believe that it is necessary to carry naloxone. This right here is a reversal medication. Um, this is an emergency treatment for an opiate overdose. Opioid overdoses right now is what is killing generations. By carrying this, you can be prepared to help save a life in the event of an opiate overdose. Naloxone is a critical tool in addressing the crisis and helping reduce the number of overdoses and overdose deaths. You are protected by the Good Samaritan laws in many areas. That Good Samaritan law is what protects a person that administers naloxone in good faith from legal liability. And by providing or administering naloxone, Narcan, um, it can reverse the effects of an overdose and potentially save a person's life. Um, if you don't know what an overdose looks like, it would be important to get some education, but I'll give you a brief summary of what you can see or the signs of it. Slow or no breathing, blue or grayish lips and fingernails, unresponsive to shouting or shaking, and gurgling or snoring sounds. Um, Insert the tip of the spray device into the nostril and press the plunger to release the dose. There is always going to be instructions on the back of your box. Um, You can get any naloxone, Narcan. Um, you can get it at doctors, hospitals, pharmacies. Um, I believe there is a vending machine in Yakima. It's always important, even though you're not using as a contributing member to the society, just a person in general. If you have kids, we don't know what we're going to come across, and it's always important to be prepared. So, let's not wait for another tragic story to hit close to home. We need to act now. I urge each of you to get involved in this fight against substance use. Volunteer at local treatment centers, support policies that increase funding for mental health services, and spread awareness about resources available for those struggling with addiction. Raise your hand if you feel like you're willing to commit to making a difference in this fight. Together, we can create a safer, healthier community for everyone. My credibility on this topic comes from personal experience of working with people struggling with addiction, and I also have family members that have this issue. This has given me the firsthand insight into the challenges faced by family dealing with substance abuse. Additionally, I have spent significant time researching and advocating for substance use treatment, making me a well-versed in the issues of potential solutions. Research shows that communities with higher access to rehabilitation centers see a significant reduction in overdose deaths. By increasing funding for such centers in our community, we can expect a similar decline in fatalities. It is crucial to advocate for more resources to support these facilities. All individuals deserve access to health care, including mental health and substance abuse treatment. Our community members struggling with substance use currently lack adequate access to these services. Therefore, our community must increase funding and support for mental health and substance abuse treatment to ensure everyone gets the help that they need. I did get a lot of my information from the NIDA, which is the National Institute on Drug Abuse, the SAMHSA, which is the Substance Abuse and Mental Health Services Administration, and the CDC, the Centers for Disease Control and Prevention. I just wanted to highlight the personal stories of families affected by substance abuse. We can evoke empathy and a desire to help. Using this information, we can educate or try to help other families dealing with it or just needing some sort of information or support. It's always important to be empathetic and to really be compassionate to people dealing with substance abuse issues. We never know who we have around us that are dealing with this issue. Thank you for your time.